Well, in the race to vaccinate, many states are working to encourage COVID vaccines as research shows hesitancy among minority populations.
One of the groups working to vaccinate minority veterans is the VA, with VA medical centers vaccinating at similar rates to non-minority vets. Dr. Ernest Moy is the executive director of VA's Office of Health Equity, and he joins us this morning to talk about the challenging road ahead. Good morning.
Good morning. It's a pleasure to be here.
Well, we appreciate you talking with us about a very important topic here. There is some hesitancy out there regarding the vaccine. So I'm curious, what are you seeing specifically within the VA and minority veteran populations?
Yeah, we were worried about vaccine hesitancy, especially among minority veterans, but we're not seeing it really. We've vaccinated over 2 million veterans, and our refusal rate is about 3.5%. And Black veterans and Hispanic veterans are being vaccinated at higher rates than white veterans. So for instance, at VA Portland, among veterans age 75 and older, our highest risk population, more than half of Black and Hispanic veterans have been vaccinated, compared with about 48% of white veterans. We're simply not seeing greater vaccine hesitancy among minority veterans.
Okay, so we do know that we have seen among just the Black population, Hispanic population, the death rates do seem to be higher when it comes to COVID. So what is the VA doing just to reach out to those minority communities about the COVID-19 vaccination?
Well, I'll say one thing really quickly, which is in our system, once you get into our system, we don't see differences in your survival rate among different racial and ethnic groups after you get into our system. But we've been working on trying to minimize disparities faced by minority veterans for over a year. So back in April, when we saw the cases of COVID spiking among minority veterans, we set our researchers to work to understand what happened during past pandemics. And what they found was that during past pandemics, minorities were more likely to be infected and less likely to get vaccinated. And we said we can't let that happen to our veterans. And so we started talking to our veterans. We had focus groups with minority veterans, and we asked them, how should we talk to you about COVID and vaccination to make it maximally effective for you, maximally informative? And they told us there are two basic needs. These were trust and truth. So they wanted to get information from someone they trusted, their provider or another veteran. And they wanted the truth. They wanted scientific evidence. They didn't want rhetoric. So our providers have been speaking with their patients since early in the fall about vaccination. And when vaccination was approved, we put out summaries of the scientific information so it was available for everyone. And our VA medical centers, when veterans become eligible, they will call those veterans, and if the veteran's interested, they can sign them up for vaccination right then and there, a lot easier than outside of VA. And right now we have a campaign to try to debunk myths that have arisen related to vaccination. And I think it's this whole combination of activities that have enabled us to reach many, many more veterans than normal and minimize vaccine hesitancy.
Yeah, that myth busting is so important. Not to paint with too broad a brush here, but obviously the first vaccinations are going to be going out to those older veterans populations, those high-risk groups. As we move into some of the younger veteran populations, do you see some challenges ahead in reaching some of those younger minority veterans groups?
We're concerned, but the younger age groups won't get as severely ill and are less likely to die from COVID. I mean, not zero, there is risk still, but it is less. But I will focus instead on our added ability to reach veterans for vaccination. So I vaccinate outside of VA in the community, and in the community, I've vaccinated many veterans. I've vaccinated veterans who were not enrolled in the VHA system and hence were not eligible for vaccination inside our system. And I've also vaccinated veterans who refused vaccination in the VA system. Last month, I vaccinated a sweet couple, and they had promised each other that they would be vaccinated together. And at VA, the veteran could get vaccinated, but the spouse could not. But now that changes. With the Save Lives Act, all veterans, both those in our system and those not enrolled in our system, as well as spouses, can get vaccination. And we think this will really, really enhance our ability to get shots into arms.
Okay, and so where can veterans go for more information about, when their local VA medical center will have those vaccines available?
So the first place to check is actually with the local VA medical center. If they need help identifying their local VA medical center or they have questions about COVID in general, they can go to our main VA website at www.va.gov.
Okay, Dr. Ernest Moy from the VA's Office of Health Equity. Thank you for joining us today. Some really important info we want to get out there.
Thank you for helping us get it out there.